Well, it's National Carers Week, and I'd like to take this opportunity to acknowledge all those East Metropolitan Health Service staff who've cared for or continue to act as carers for their loved ones beyond their roles at the workplace. While I wasn't part of East Metro at the time, I'm sure that it was an exceptionally proud moment when in December last year, the Royal Perth Bentley Group became the first employer across all industries in WA and the first in healthcare group in the country to be formally recognised with a Level 2 accreditation in the Carers WA Carers Plus Employers program. Such an accreditation speaks to the heart of East Metro culture and the strong commitment to care for our patients and one another. RPBG was accredited for supporting staff wellbeing in terms of both practical support and providing key resources for carers and managers. Now, encouraged by RPBG's success in this space, we'd like to see all of East Metro, including our corporate division and the Armidale-Kalamunda Group, embrace this same ethos by taking steps toward achieving accreditation and ultimately improve how we care and support unpaid carers who work amongst us. With my own experience of caring for a family member, as executive sponsor of this project, and as Executive Director, People, Capability and Culture, I couldn't be prouder to lead East Metro forward in this important space.
My mum has experienced deteriorating health over the last few years and was recently diagnosed with Alzheimer's. It's been a difficult time for our family. While my dad remains my mum's primary carer, I assist them with navigating through the hospital and community services, the aged care assessment process and advocating for their needs and support, and providing what my dad calls Meals on Wheels for them. I do big weekend cook-ups and ensure my mum and dad never have to worry about preparing an evening meal. Throughout this, I've been fortunate to have always had the support of my managers, that being the Royal Perth Bentley Group Executive Director and the Group's Director of Nursing. This has enabled me to work flexibly and fulfil the duties of my role while still managing urgent matters related to my mum and her ongoing care.
I didn't know that I was a carer. When a loved one is sick, you just look after them and you don't really think about it. I read a Carers WA pamphlet in the Kalamunda Hospice and only then realised that I was a carer too. At that time, I was caring for my husband who had pancreatic cancer and I had to stop working. He had been sick for about 4 years. We were living in the country and very isolated, so I was driving 2.5 hours to the hospital for treatment every fortnight. Every now and again, there was an emergency trip to Perth. It was getting very difficult, so we decided to relocate back to Perth. Once we had settled in Perth, there were still emergency trips to the hospital, but we were only 20 minutes away, which made life much easier for me. Also, having more family around to help was great. I joined the Lived Experience Advisory Group, as carers and consumers are vital to the hospital for information and ideas from the other side of the fence.
My late husband, Aleem, was diagnosed with cancer of the bile duct in early 2022, with his doctor at Armidale Hospital advising he just had about 3 months to live. Being a carer was like an out-of-body experience for me. From the very beginning, we were surrounded by love and support from my colleagues and managers, which helped me focus on just being there for Aleem and the kids. My ICU colleagues cooked for me, I got regular groceries and toys. My hive nurse manager and educator would visit me regularly at home. They would listen to me talk about Aleem and the kids and how we were as a family. My Bonstato colleagues would reach out to me all the time. My medical colleagues from Armidale and Hive did all the hard work of looking for the best specialists and ringing around for different healthcare options for Aleem. I didn't have to stress about my leave or pay. It was all sorted by my nurse managers. Caring for Aleem was the easiest thing I did at the time. He passed away at home, surrounded by his family and friends, exactly 3 months to the day of his diagnosis. We have been broken as a family since, because we don't have our biggest support. but we're okay. And one of the main reasons for this is because my East Metro colleagues were exceptional. They were all carers for me,